I'm F.J. Campbell, the Chief Medical Officer and Chief Quality Officer for Ardent Health Services, and I want to take time today to talk to you about COVID-19 vaccinations. As a father and as a clinician, I felt very, very comfortable getting all of my children vaccinated, including one who was 15 years old. I've been contacted by many family friends, and I've advised all of them that as soon as the vaccine becomes available for your child, for their age, you should definitely get it. I'm far more concerned about the effects of COVID-19 as a virus than any concerns I would have about COVID-19 vaccinations. Greg, this is a really good question, and obviously it's quite timely. Vaccines in general for women who want to get pregnant and vaccines for women who are pregnant have been safe for decades. What's important to know is that the COVID vaccine, an mRNA vaccine, is even in a safer category because it is not a live vaccine. Here's what is most important to me. Viruses can be very, very concerning for women who are pregnant. It can lead to preterm labor. It can lead to more challenging deliveries in terms of respiratory conditions. Therefore, I am far more comfortable with a woman getting a COVID vaccine than a woman getting pregnant and getting the COVID virus. The complications are much, much clearer for a woman who is pregnant and getting the COVID virus. Regarding your concerns for how well we can know the long-term safety and efficacy of these viruses on an unborn child, again, I have to go back to the literature for vaccinations in general for pregnant women, which have not shown any significant birth defects for unborn children. Linda, this is going to give me an opportunity to make a shameless plug for My Ardent and the My Ardent homepage. No fooling, it has really, really good information. And specifically, when you go to the My Ardent homepage, you'll be able to go to the carousel and you're going to be able to see a specific article related to proof of COVID vaccination and traveling. I would absolutely get my child vaccinated for COVID. I appreciate how upsetting and traumatic it can be for your daughter to get a vaccination. I have a daughter who's just like that. It is very, very hard to watch that as a parent. What I know is that that's a transient experience. What I'm really afraid of are the long-term consequences of getting COVID, which absolutely can affect teenagers. No two ways about it, I would get my daughter vaccinated. Leah, I want to know that too. I believe that we will have clear literature with that after the first year of the vaccinations being in place. That is something that is being actively studied by both Pfizer and Moderna, along with Johnson & Johnson. Right now, the belief is it should last at least 12 months, but time will tell, and there's more literature that we're going to have to review. My personal belief is that the benefits of getting a booster shot versus safety concerns will be clear, and the benefit will outweigh dramatically any concerns. So I do believe that there is a strong likelihood that boosters will be in our future. I don't see that happening within the first year of the vaccination. Vincent, thank you for your question. The clinical trials for vaccinations for children versus adults are just as rigorous. and therefore the safety data coming out of clinical trials for pediatric populations for the COVID-19 vaccination are strong, are reasonable, and demonstrate a very good safety profile. With that in mind, I think you should feel very comfortable having your children vaccinated. Jan, right now everyone's talking about the Delta variant, and the vaccines in general, Pfizer in particular, are showing great efficacy against the Delta variant. When you're hearing about people who have received the Pfizer vaccine and now have a COVID-19 infection with the Delta variant, they're showing very, very mild symptoms and are not requiring typically hospitalization. Of note, when we are looking at patients coming into Ardent, well over 98% of them who are getting admitted have not been vaccinated. In the small percentage of people who have been vaccinated and have to come to the hospital, they have very mild symptoms overall, and we have had no mortalities associated with anyone coming to the hospital with COVID-19 who have been vaccinated. Albert, first things first. The J&J vaccine has proven very effective against the COVID-19 virus. I want you to have a comfort with the fact that you've received that vaccination. Now, there is evidence that the Pfizer and Moderna mRNA vaccinations have been proven more efficacious, which has led some people to say, all right, fine, I want to make sure I get a booster with that. Here's the thing, we don't have enough data to basically demonstrate that you should get a booster after getting the Johnson & Johnson vaccination. It has proven quite effective, and until we have a better understanding of how we would even combine the mRNA vaccines with Johnson & Johnson, we just don't have enough data to support those next steps. I personally would not take a booster with an mRNA vaccine if I received the Johnson & Johnson vaccine unless that was part of a clinical trial. I want to thank all of you for sending in your questions related to COVID-19 vaccinations. And if you have more questions, we'll be happy to have further conversations on this. It's pretty clear that my bias is towards getting the COVID-19 vaccines. I'm far more frightened of the COVID-19 virus than any potential complications associated with the vaccines. As a result, I strongly encourage all of you to get the COVID-19 vaccination as soon as you're able to. Thank you.